Hi, my name is Alex Everett, and I'm going to be doing my administration of medication checkoff today. So the first thing I would do is walk into the medication room, and I would shut the door behind me, and I would limit any distractions. I would not take phone calls. I would limit conversations with colleagues to the minimum, only pertaining to what I'm doing, and I would follow the hospital's no interruption policy. And so now the first thing I'm going to do is perform the 7 rights for my patient. So I'm going to check that I have the right patient, Mr. Jaguar Jones. Jaguar Jones, I'm going to use 2 identifiers. His date of birth is 08/25/1963, 08/25/1963. Medical record number is 4176352. Medical record number is 4176352. He is allergic to penicillin. And so the right medication we are giving is morphine sulfate. We are administering the correct dose of 5 milligrams and 5 milligrams. It is going to be given intramuscularly. It's going to be given every 4 hours. So we have the correct time, and it is going to be given PRN for pain or as needed for pain. And I have the correct documentation, and it lines up the medical history and the MAR. Alright, so now that I've done the first check, I am going to begin preparing the medication. So I'm going to perform hand hygiene. I'm going to pick my medication. I have my morphine sulfate. It is not expired. So here's my morphine sulfate. So now I'm going to check the vial with the MAR. So I do have the morphine sulfate. I'm going to be giving 5 milligrams. This vial says that there are 10 milligrams of morphine sulfate per 1 milliliter. So I will be giving my patient 0.5 milliliters of medication. I'm going to be giving it intramuscularly, so I'm going to get my supplies for that. I'm going to need a 3 milliliter syringe. I'm going to need a blunt plastic cannula to draw up the medication initially, and a 21 gauge 1-inch needle for the actual injection. So, and I'm going to be giving it the correct time every 4 hours. He has not had his medication in the last 4 hours, so I will be giving that to him, and it is as needed for pain. So now I'm going to begin drawing up the medication. Get an alcohol pad. So first thing I'm going to do is pull back 0.5 milliliters of air. I'm going to push that into the vial and draw up my 0.5 milliliters of medication. Alright, so I have my 0.5 milliliters in my syringe. Going to recap it, and now that I have my medication drawn, I am going to check with the syringe and the vial and the MAR for another check of accuracy. So I have the morphine sulfate, 5 milligrams, which is 0.5 milliliters of the actual medication. It's going to be given intramuscularly. I collected my supplies for that. It's going to be given every 4 hours, and it's as needed for pain. So now that I have drawn up the medication, I am going to write a label for the medication. On this label, I'm going to put the patient's name, which is Jaguar Jones. The medication, morphine sulfate. And the dose, which is 5 milligrams or 0.5 milliliters. So now I have that written. I'm going to apply it to the syringe. have the label created. And now that I have my medication drawn, I would also check with another nurse to verify my order and make sure that I have drawn the correct amount and that I've done my calculations correctly. And so now I'm going to do another check of accuracy. I'm going to check that this is for Jaguar Jones. Jaguar Jones. It is morphine sulfate, morphine sulfate, morphine sulfate, 5 milligrams or 0.5 milliliters, 5 milligrams, and it's being given intramuscularly. I have the equipment for that every 4 hours. He has not had his pain medication in the last 4 hours, and it's PRN for pain or as needed for pain. So now I am going to remove the cannula and apply my 21 gauge needle. Alright, so now that I have done all of my checks and I have changed my needle, I'm going to take the vial, the MAR, and my syringe to the patient's bedside. Alright, so now I'm at the patient's bedside. The first thing I'm going to do is perform hand hygiene. And then I'm going to raise the patient's bed and lower the side rail so that I can take a look at their armbands. I'm going to verify that this is Mr. Jaguar Jones. It is Jaguar Jones. Medical record number is 417-6352. Medical record number is 417-6352. He is allergic to penicillin. Allergic to penicillin. He has an allergy band. And I would ask if there's any other allergies that he has that he has not told me about. And so now that I have verified the patient, I am going to perform any health assessments that I need. So I'm going to check the respiration rate, blood pressure, and do a pain assessment. And once I've done those, I'm going to do my last and final check to make sure that I have the correct dosage. So this is for Mr. Jaguar Jones. Jaguar Jones. It is morphine sulfate. Morphine sulfate. I have the right patient, the right dose, or the right medication. I have the right dose, which is 5 milligrams or 0.5 milliliters. I have the right indication, which is PRN for pain. I have the right time, which is every 4 hours. He's not on his pain medication in the last 4 hours. And I have the correct documentation, the MAR, and I have the intramuscular way of giving him his shot. So now I'm going to don my gloves and put on my goggles. So at this point, I would explain to my patient what I'm going to do. So Mr. Jones, I am going to administer your pain medication now. So I'm going to position you onto your side, and I'm going to be giving your pain medication in an intramuscular area known as the ventrogluteal area. And so now I'm going to prepare the site to have the injection made. So the way I find the ventrogluteal site is by placing the palm of my hand or the ball of my hand on the greater trochanter of the hip. And then I'm going to place my index finger towards the anterior superior iliac spine and my middle finger towards the iliac crest. So now that I've identified my location, I'm going to get another alcohol pad and clean the injection site off. So I'm going to do it in circular motions and put the alcohol pad pointing to where I'm going to inject the site. So now that I've cleaned the area, I'm going to remove the lid and I'm going to spread the skin and put it in a 90-degree angle. I'm going to aspirate for any blood return There is no blood return, so I'm going to go ahead with the medication and I'm going to insert it slowly. So now that I'm done, I'm going to put it in the sharps container, put a little pressure on the side of the injection. I'm not going to massage. This is just to catch any excessive blood and relieve some pain. And so now that I'm done, I am going to reposition the patient. I am going to raise the bedside rail and lower the bed to the lowest position. I'm going to remove my gloves towards the trash can, my goggles. And at this point, I would watch Mr. Jones for a little bit I would watch Mr. Jones a little bit. I would perform hand hygiene, and then I would watch Mr. Jones to make sure he does not have an allergic reaction just for a couple minutes. Then I would go do my documentation. I would document the procedure and how he responded to the procedure, and I would go back within 30 minutes to make sure that he is not having an allergic reaction, because that is something that happens with pain medication.